Good. Today I would like to inform you of the dangers of smoking and how you can quit. It's very important to me because I smoke and I'm trying to quit, and I think that it's important for everyone to know that it's possible for anyone to quit. More deaths are caused each year by tobacco use than by all deaths from HIV, illegal drug use, alcohol use, motor vehicle injuries, suicides, and murders combined. Smoking is very dangerous and it causes many serious health problems, and it's also extremely inconvenient. Quitting now can return your body back to normal and make you feel better almost immediately. There are many aids to help people quit. So let's start by talking about the serious and fatal diseases that smoking can cause. It increases the risk of heart problems. If you're a smoker, you're 2 to 4 times more likely to get coronary heart disease, have a stroke, or have a heart attack than someone who has never smoked. And it also increases your risks of emphysema. It also increases the risks of lung problems. If you're a man and you smoke, you are 23 times as likely to get lung cancer than someone who doesn't smoke. And if you're a woman who smokes, you're 13 times as likely to get lung cancer than a woman who doesn't smoke. It also increases the risk of chronic lung disease, such as bronchitis. And if you smoke, you're 13 times as likely to get chronic lung disease, according to the CDC. There are also many other cancers that smoking causes, not just lung cancer. Some of these are lip cancer, pancreas cancer, bladder cancer, kidney cancer, and cervix cancer. It also greatly increases the risk of infertility in women. Not only is smoking very dangerous, but it's also really inconvenient. It's extremely costly. I spend $35 a week on cigarettes, and I'm a college student. I can't afford that, and I don't think anyone really can in today's economy. It also causes shortness of breath. It's difficult to exercise or walk up the stairs. And when you smoke, everything smells like smoke. Your house, your clothes, your hair, and it also gives you bad breath. So what are the benefits of quitting smoking? After a day, your heart rate and blood pressure decrease, and the amount of carbon dioxide in the blood also decreases. And after a year, your blood circulation and lung function increase, and the shortness of breath and coughing that smokers often experience decreases. In the long term, the risk of the many cancers that smoking can cause decreases drastically. And after 15 years, your risk of heart disease is the same as that of a non-smoker. There are many options to help you quit. There are methods of nicotine replacement therapy, which basically puts nicotine in your body without smoking, and you can wean yourself off of it that way. There are 5 methods of nicotine replacement therapy. There's nicotine gum, a nicotine patch, nicotine nasal spray, and nicotine inhalers, and there's also nicotine lozenges. The nicotine gum and patch and the lozenges have different doses, so you can help you wean yourself off the nicotine. There are also medications that don't contain nicotine that can help. There's a medication called Chantix that blocks the receptors in your brain and makes you not want to smoke. And if you're on Chantix, you're 3 times as likely to quit compared to someone who tries to quit without any medication. There's also a medication called Zyban, and if you are on Zyban, you're 2 times as likely to quit as someone who is trying to quit cold turkey. There's also a lot of tips that can help you quit without medication. A lot of people say that a change of environment will help you a lot. People will say that you should avoid alcohol because a lot of people that are trying to quit smoking relapse when they drink. You should also avoid smokers because if your friends are smoking around you, you're going to want to smoke. You should get rid of all the cigarettes and ashtrays and lighters in your house and in your car at work because they'll just remind you of smoking. And you should also change your daily routines and take a different way to work or eat somewhere else for breakfast just to change your routine so that maybe you won't include the cigarettes in your new routine. and keep yourself busy to distract yourself from all the cravings of smoking. Another method to help you quit without medication is support. Ask your friends and family not to smoke around you. And it can also help you a lot to quit with a friend, because if you're quitting with a friend, then you're motivating each other to quit, not just yourselves. There's also a lot of group counseling sessions at clinics for people who are quitting, and that can help you a lot. The purpose of this speech was to inform you of the dangers of smoking and to inform you of the methods to quit, and I hope I did that today. Thank you very much for listening.